This podcast is for educational purposes only and is intended for medical professionals. It does not provide medical advice or establish a provider-patient relationship. Always consult a qualified healthcare provider for medical concerns. While we strive for accuracy, medicine evolves, and listeners should verify information with trusted sources. Views expressed are personal opinions and do not reflect any organization's policies. Listener discretion is advised, and we assume no liability for reliance on this content. All rights reserved. Unauthorized use is prohibited. Pthora, Medicine in 5 Minutes Beta Blockers Crash Course. Welcome to Pthora Medicine in 5 Minutes, where we simplify complex medical topics quickly, clearly, and maybe even a little fun. Today, we're diving into beta blockers, covering how they work, when to use them, dosing, BMI considerations, and precautions. Let's get started. Pthora's 5-Minute Medicine Beta Blockers Edition. Welcome to Pthora's 5-Minute Medicine. Quick, focused, and packed with insights to keep your practice sharp. Beta blockers, your heart's chill pill. Fun and practical guide. What are beta blockers? Think of beta blockers as the Zen masters for your heart. They block adrenaline, keeping your heart rate chill, your blood pressure calm, and your stress levels low. Basically, they're the bouncers that stop your heart from overreacting to drama. They're not about taking over your heart's job. They're more like coaches, guiding it to work smarter, not harder. Top uses for beta blockers. Beta blockers wear many hats. Here's what they're great at. High blood pressure? Beta blockers equals relax arteries. They ease tension and help your blood flow without breaking a sweat. Heart racing? Got arrhythmias? Beta blockers can calm that internal drum solo down to a smooth jazz rhythm. Heart failure? Think of them as support staff for your heart, cutting the workload so it can rebuild and get stronger. Chest pain, angina? They slow things down, giving your heart a break and a chance to keep up. Migraines? No one likes pounding headaches. Beta blockers keep triggers in check so you can think straight. Stage fright? Sweaty palms, shaky hands, pounding chest? Beta blockers are like that friend who whispers, "You've got this." Thyroid storm? When your thyroid's on hyperdrive, beta blockers hit the brakes, keeping symptoms under control. Titration. It's all about balance. Beta blockers aren't a one-size-fits-all deal. They're more like a tailored suit. The dose needs to fit your clinical picture, not just the numbers on paper. But how do we get the perfect fit? Titration. Titration? Think of it like tuning a guitar. You start low, make adjustments, and keep tweaking until the rhythm feels just right. Here's the process. Feeling dizzy? Maybe we went a little too far. Pull back a bit. Still feeling like your heart's running a marathon? Time to tune up and add a little more. Keep testing until the heart's rhythm matches your life's tempo. Steady, calm, and in sync. It's not just about the numbers. It's about how you feel and what your body needs in that moment. BMI and dosing. Does size matter? When it comes to beta blockers, size does matter, but not in the way you'd think. Higher BMI 30, with more cushion comes a higher volume of distribution, meaning you may need a bigger dose to see results. Think of it like filling a bigger tank. Lower BMI 20, smaller frames need smaller doses. Too much, and the effects might hit harder than expected. It's all about finding that balance to keep things steady without overdoing it. Side effects. Watch out for. Even the chillest medications can throw a curveball. Here's what to look for. Slow heartbeat? Your heart's got rhythm, but don't let it slow dance too much. Monitor it. Feeling lightheaded? Low BP could be the culprit. Stand up slowly and keep an eye on it. Breathing issues? Non-selective beta blockers can trigger wheezing in asthma or COPD. Go cardioselective if this sounds like you. Too tired? Fatigue can be an early guest, but usually leaves the party once your body adjusts. Masked sugar crashes? If you're diabetic, beta blockers might mask low blood sugar symptoms like shakiness. Don't skip those blood sugar checks. How to taper beta blockers. Break up slowly. Why taper? Because cold turkey equals drama. Rebound symptoms like crazy BP, rapid heartbeats, and chest pain? No, thank you. Beta blockers need a graceful exit, not a sudden drop. Taper plan. Drop the dose gradually, usually by 50% every 1-2 weeks. Track symptoms like palp, irritations, headaches, or anxiety. If any of these pop up, pause and reassess. Slow and steady wins this race. Think of it like easing off the gas pedal instead of slamming the brakes. Key takeaways. Beta blockers are your heart's BFF, keeping things cool under pressure, literally. But like any good friendship, they need care, patience, and the occasional check-in. Remember, adjustments are the name of the game. Treat each patient like a unique playlist and keep fine-tuning until the rhythm feels just right. So, whether you're calming a racing heart, keeping migraines at bay, or tackling performance jitters, beta blockers are the steady hand in your corner. Just don't forget, balance is everything, and a slow taper beats a fast exit every time. That's it for today's episode of Pathora, Medicine in 5 Minutes. Don't forget to subscribe, share, and leave us a review. Thanks for tuning in, and as always, stay curious and keep learning.